This is Moru Health Centre located in Iokea village in the East Kerema LLG Gulf province. Service delivery here is a challenge due to lack of funding, maintenance and manpower. The health centre caters to people of Iokea village and 8 other neighbouring villages including Oyapu, Miaru and Apanaipi. Sister in charge Jack Hove and community health worker Sarah Milaura are the only 2 workers posted here, and say the sub-health centre is in need of a boost to its facilities, infrastructure and supplies in order to give better health care to people.
It's one thing that we have been looking at. Our supplies don't come in at the right time. But we are very careful in how we manage our supplies that come in from Port Moresby, from the area medical stores. So our supplies since last year, we haven't been receiving, and then just this year it's only once that we got. And from my point of view, it's very low. It cannot cater for the whole 9 villages.
Childbirth is a concern as well. Staff encourage women to come for regular checkups and receive antenatal care. However, due to the geographical location of some villages and poor road conditions, pregnant women choose to give birth in the comfort of their villages instead of making the 5-hour journey to the health centre. Milaura says even the wards are not fit to accommodate patients.
For now, when you see, they say we are like health keeping people, but then we don't have proper toilet. Even our houses are leaking when it's raining. And then the hospital itself, manpower is very low. We don't have a standby ambulance where we can use to move in and out with our patients.
Referrals for critical cases are also a concern for the health workers. Not having a stand-in ambulance service for emergency cases makes their job harder.
If the condition is worse and we cannot help because there are 2 of us, just the 2 staff, so we have to send to Malalawa, from Malalawa to Kerema. But when you see that we don't have a vehicle, we don't have a standing ambulance. So what we normally do, we call Malalawa. Otherwise, if there's a vehicle running here, we tell the patient to contribute 300 kina, and then they themselves will take all the way to Malalawa, from Malalawa to Kerema.
Milaura says calling for ambulance service assistance sometimes takes up to 2 to 3 days to arrive, especially for emergency and critical cases.
The only person that I really trust is Mrs. Malaisa. She's very harsh. She's like a relative also to me. When I call, she will get on to me, and then later she called back and said, already I arranged ambulance and it's on the way. You should get the patient ready. So that's like for today, she can do that. But if I call to Kerema and the other centers, they'll tell me, you see the patient's condition and then you call back. And it's like calling now, tomorrow, and then 3 days after that, we get our feedback. By then, sometimes the patient is already dead.
Milaura says clean water supply, regular medicine stock and an upgrade to its ward are essential, especially for a service as vital as health.
It's good that we speak out, especially in services that we are supposed to give to people with.
Helen Sia, National Emtv News.